everyone, Dr. Nicole Heatherly here with Kadi Englehart.
Hello.
Welcome to another week of Coffee and Chiropractic, 40 Weeks of Kadi edition.
Yeah.
So hello everyone, thanks again for joining us for another week. This week Kadi's at 19 weeks pregnant, so woohoo,
Woo.
1 week away from being halfway through the pregnancy. So good job so far.
Thank you.
So this week, guys, the baby is the size of a mango, which is pretty cool. It's getting larger and larger. So
Yeah.
with that, you know, so her tummy is getting larger and larger. Every week Kadi comes in, I always feel a little guilty because I'm like, whoa, your stomach's gotten larger. So you can only say that to a pregnant patient.
It's true.
So just a few things going on with the baby this week. Something called vernix caseosa, which is, if any of you have ever seen a baby come right out of the womb, it's covered in this cheese-like, I know that sounds gross, cheese-like white substance all over its body. Now the purpose of that substance is to prevent the baby's skin from wrinkling when it comes out of the womb, out of the amniotic fluid. So that's developing right now. Another thing is their lungs are continuing to develop. So the biggest airway, the main airway of the lung, which is called the bronchiole, is being developed. So
Cool.
that's going on. And then lastly, you know, and we've talked about movement in the past. We talked about it in the way of the movements changing from short little jittery things to more fluid ballet-like. Well, now we're just talking about increased movement. So at this point, a lot of moms haven't felt any movement yet. I know Kadi.
I haven't really, except for that one time I felt a little flutter, but that's been weeks. So.
Yeah, and that's okay. If you haven't felt anything, don't worry. But now is the time where you may start to be feeling some stuff. So keep an eye out for that. I mean, I have many patients who are well beyond you know, maybe 22 weeks, 23 weeks, and they haven't felt anything yet.
Yeah.
So don't worry, it's gonna happen. And then some moms are like, holy crap, every time I go to sleep, they start kicking and they're feeling it a lot. So you'll get there. So what's going on with the mom this week? Some things that can be happening, especially because your spine is changing. You know, your belly's growing, so it's pulling the lumbar spine, it's pulling your low back out. So it's going to put pressure on those nerves in the low back. And remember, those nerves from the low back, they go to our digestive organs, they go to our legs, pretty much everything in your lower half. So with that, those organs can be affected. So a lot of moms at this point in time start to experience constipation because those nerves go to the digestive organs. So, you know, make sure you're getting in a lot of vegetables, a lot of fiber to help with some of that. But then also you want to support the low back. So that requires proper posture. You know, you want to watch the way that you sleep, the way that you stand. You don't really want to be doing any repetitive activities, creating certain muscle imbalances in your body. Definitely no crossing your legs. Kadi is very good at that. She's very aware.
It's hard.
She has 3 chiropractors keeping an eye on her. So, you know, just watch your overall day-to-day activities. So that you're not undoing anything. And then, of course, getting adjusted so that we can make sure those bones in the low back are in place so those nerves can work how they should.
Of course.
Have you noticed any symptoms lately within the past couple of weeks? Any kind of symptoms in your body?
You know, I've noticed lately that at the end of the day, you know, I spend a lot of my day on my feet. So at the end of my day, my feet and ankles tend to be bigger than they used to be. They're a little swollen. And some leg cramping, I've noticed that as well.
Yeah, and that's another big one, leg cramping with pregnant patients. You know, again, those nerves from the low back go to the legs. So if those nerves aren't functioning like they should, then they will tell the muscles to tense up. So that's one reason for leg cramping. Another reason is, you know, it could be due to decreased calcium. So sometimes we have our patients take calcium at night. It can kind of act as a natural muscle relaxer to relax the muscles. And then it could be your sleeping position too, putting more pressure on those nerves. So make sure your bed isn't too soft. You know, you definitely don't want to sleep on your back or your stomach. Sleep on the side. Left side is preferred. You know, so just, again, watching those daily activities so that we can limit the amount of pressure on your spine.
I'll be sure to do that.
Yes, and if not, we'll remind you.
Thank you.
And then the last thing I wanted to talk about this week, I've had a lot of pregnant patients ask me about dizziness. They're like, Dr. Nicole, I randomly get dizzy. Do I have vertigo all of a sudden now? You know, and I always say, well, it could be technically deemed vertigo, but it may not be. You know, we know those nerves from your neck go to your ears, and they control everything up here. So a lot of times a misalignment in the neck will produce the dizziness. But it could also be blood flow. You know, as your uterus is growing and expanding and your body's changing, different pressure is happening at different spots in your body. And so when we put pressure on a blood vessel, it can reduce the blood going to the brain and then cause that dizziness. So, you know, obviously get checked by your chiropractor is the number one thing to make sure those nerves are functioning okay. But besides that, if you ever do feel dizzy, I always tell patients, sit down right away. You know, you don't really want to risk falling. Especially if you have a baby in there. So the main thing is to be aware of how you're feeling in your body, and if you are feeling that dizziness, to take a break, sit down, and relax a little. So anything else that you want to add this week, Katie? Updates that you want to give?
Next week, make sure you tune in because I have my ultrasound with my anatomy scan and gender reveal on Tuesday. So next week, be sure to tune in so you'll find out if we're having a little girl or a little boy.
Yes. So see you guys next week. That's all we have for you. Have a good one.
Cheers.
Cheers.